Okay. As Andrea indicated, my name is Deb Anderson. I am a regional manager at the Springfield Regional Office for Specialized Care for Children. I've been with Specialized Care for Children for 21 years, so I've seen a lot of changes over the years. Before that, I've been involved with children with disabilities basically since I got out of school, nursing school, back in the early 80s. So my experiences are varied. That's just my discipline information, my background. Let me also say that I haven't ever done a presentation where there was no visual. So this is a little new for me, and I hope I don't stumble, hem, and haw too much for you. I apologize in advance if I do that. I am going off of a presentation that I'm looking at PowerPoint slides and kind of adapting here. I have practiced a little bit, but things could get a little jumbled. Again, I'll apologize in advance for that. We are the Division of Specialized Care for Children. A lot of times we go by initials, DSCC. That has an unfortunate consequence. Sometimes we are confused with another state agency that is not always perceived as a very friendly state agency. We are not them, we are us. We try at all times to be friendly, and there is no obligation to use our services. We are here if you need us. Okay. I don't know how many of you are on the phone or familiar with our agency. We've been around for a very long time. We have changed and morphed through the years, but we were established back in 1937. We are the Illinois Title V agency for specialized treatment and rehabilitation of children with certain physical disabilities and health impairments. What that means is we get federal funding. Okay, there are Title V programs in every state, but they do not operate the same way. This agency, the funds and the administration come through the University of Illinois at Chicago, which is why you always see the UIC logo on all our letterhead and forms, and why UIC is listed with our name. That's just some background information for you. It doesn't mean a whole lot as far as administration of services, but it helps you understand who we are, where we come from. The biggest service that we offer is what is referred to as care coordination. The staff in the regional offices work as care coordination teams. What we do is work with the family and healthcare professionals and other professionals and service providers out in your communities to help children with disabilities and those who have conditions which may lead to disabilities. We want these children to reach their full potential. The point of care coordination is to provide, promote, and coordinate family-centered, community-based care for eligible children with special health care needs. That's basically the canned phrase for care coordination. What we have are teams. We have a care coordinator who is a professional level staff and a program coordinator assistant. They're a paraprofessional staff. They are assigned to each child. So you have a team. Now, that doesn't mean that's the only person you can talk to. That just means that they're your primary contacts, and they will more easily be able to help you because they have knowledge of what you have requested and needed. The other people who are here can take calls and answer calls. However, they don't have the background in their heads, so they'll have to look through the record to find it. The most essential piece of care coordination, I always say, is information. It's our role to to assure that you as parents have information that you need to make decisions about your child's care. That's our job. It's also our role to facilitate communication between parents and any provider out there where there's a problem with that communication. It's not our job to create a barrier. It's our job to help you through the barriers. We have 13 regional offices around the state. There are 4 offices that cover the Chicago area. When you think of the state of Illinois and 13 offices, and 4 of them are in Chicago, you realize that the areas that are covered by these offices are pretty large. I'm out of the Springfield office. We cover 15 counties in west central Illinois. There is an office in Rockford, one in Rock Island, one in Peoria, Champaign, Olney, St. Clair, which is the East St. Louis area, and then there's another one down in Marion, one in DuPage, and then, as I said, 4 other Chicago offices. When you call, if you're not already a client, or it's how you determine which office you're to get a hold of, it's by county or by zip code. In Chicago, it's by zip code. Obviously, there's a lot more people up there. Downstate, we are assigned by county. There are a couple, couple different hoops to jump through before we determine whether or not we can have a child as a quote-unquote registered client. Anyone can call and ask us a question. We can answer even if you're not a registered client. If your child's not a registered client and you just have a resource question, you can call an office and ask for assistance without going through all the hoops of filling out the paperwork. If you're going to need ongoing assistance, resource or otherwise, it's a whole lot easier if you have an active record with us, okay? The main thing is that the child has to have an eligible condition, a medically eligible condition. Not everything is eligible. We only deal with specialized needs. One of those, obviously, if I'm talking to all of you, one of the types of eligible conditions is hearing loss. There are also things like orthopedic conditions. That's anything to do with bone, muscle, joint that meets our criteria. Heart defects, some neurological conditions, cystic fibrosis, some eye impairments. Now, we're not talking just a child who needs glasses, but something that would require possibly surgery, eye patching, those types of things. Hemophilia is eligible. Some types of metabolic disorders are eligible. Some urinary, kidney or renal, bladder functions, and some what we label external body impairments. Those are things like cleft lip and palate, ear deformities, actual malformations of the external ear, things like that. What we don't cover any acute childhood illness or injury, anything like a broken leg or strep throat. We don't cover routine dental care. You know, when you take the child to get their annual or biannual dental examinations and cleanings and fluoride treatments, we don't cover that. We don't cover well child care. We don't cover immunizations or school physical exams. We also cannot support treatment which is experimental or investigational. Okay, In order to receive ongoing services from DSCC, or Specialized Care for Children, there is an application process. The application process can be cumbersome. There's a lot of paper. I indicated that we have federal funding. We do. We also get state funding, and we are affiliated with a university. If you think of those three types of bureaucracies, you will realize that there's a whole bunch of paperwork that they can pile on. While we have to complete the paperwork and we are responsible for assuring our various funding sources that we're complying with all their rules and regulations, it's not our intent to make this difficult for you. However, having said that, I recognize that it can be difficult. There's a lot of paper. We will send it to you. We hope that the instructions are clear. If the instructions are not clear, or if you can't figure out what the heck you're supposed to put where, call us. We are here. We will answer. We can even, in some areas, more easily than others, come to you or have you come to our office so that we can help you fill the papers out. We'll do what we can to get you the help that you need. Okay. So we send out this application. Then we say you have to, the child, when we get it back in, we're going to check for a couple different things. We're going to check for general eligibility. So the child has to be under age 21. You and the child have to be Illinois residents. You have to live in Illinois. If you live over in Missouri, just across the state line, and you work in Illinois, that doesn't count. Your child is not a resident of Illinois. Your child is a resident of Missouri. Okay. You also have to be U.S. citizens. You or the child have to be U.S. citizens. We have to look at that. Then we look and see if the child has an eligible medical condition. If you meet general eligibility, that's the age, residency, and citizenship, and if the child has an eligible medical condition, then we will provide care coordination services, and I kind of talked about that earlier. That's the whole information piece. If you also meet financial criteria, we can assist with payment for some of the specialized medical care, not the routine medical care, but the specialized medical care. Okay? When we send out the papers and we tell you we have to have the paperwork back, part of what we ask for is a current tax return. That's because we go by federal income guidelines, okay? And we need to know your family size and your taxable income. And that's on your tax return. That's why we ask for it. If you don't file taxes, we'll talk you through it, what we need from you and what other kinds of things we need. Okay. If we get all the paperwork back and we send for reports on your child and we don't have enough there to determine whether or not your child has an actual condition that's eligible for our agency. But we think, based on the reports we have and your statements to us and other information that we get, we think your child might have an eligible condition. We will help pay for the evaluation by the specialist, a one-time visit, to see if, in fact, a diagnosis can be given. So we'll help you find out. We are a payer of last resort. What that means is we ask you to use your insurance card first, or if you don't have insurance, if you have all kids, or if you have both, we ask you to use those to pay first, and then we help out financially. Now that, what we call that diagnostic evaluation, where if we don't know your child has an eligible condition, we don't care what your income is on that. We're going to help you find out what the diagnosis is. But that's a one-time appointment. It's not an ongoing, well, maybe it's this, maybe it's that, maybe it's the other. We kind of fine-tune it down and send you to the one place. Okay. After that, if the child has an eligible condition, then we will look at your income to determine if we can continue to pay for specialty care. This all can be a little confusing. If you have specific questions, you can always call the regional office, and I'll give you a way to get to all those phone numbers here in a little bit, but you can always call and talk to somebody about these things, okay? If your child has an eligible medical condition, like I said, the care coordination teams will work with you. We'll work on facilitating any kind of communication that you need help with between you and the doctors, the school, Social Security, all kids, just about anybody you can think of that you have a problem with. We will either help you communicate with them, or we will make sure you know who can help you. We'll never say, oops, no, sorry, that's not something we deal with, and let it go at that. We might say, wow, that's not something we're really trained to deal with, but let me check on it, and I'll get you some names and numbers of people who can. Okay. The other thing that the care coordination team is going to do with you, there was a reference that Andrea made earlier to transitioning from an ISSP to an IEP. One is a family service plan for early intervention. The other is an individual education plan that you have through the school system for your child. We also have service plans, unfortunately. So you'll have multiples of these. The service plan that we focus on is more specific to your child's medical needs, identifying the physicians, what kind of follow-up is needed, and that kind of thing. We do incorporate other aspects into the plan as well. We will provide any kind of information, resource, transition planning that you need. Transition planning, there are various points in your child's life where transition from one aspect of their life to another aspect of their life occurs. From early intervention to school, from school to adult work or college. All those are kind of transitions. The federal government really focused on the adolescent transition, so we talk a lot about that, but we also deal with other transition ages as well. It's all about planning for the future, looking ahead to where you need to be and planning for that. We have an internet site that if you all have internet access, you can go to this site. I'm going to give it to you here. It is www.uic.edu/DSCC. On that site, there is an incredible amount of information. If you look at that site, there are links down the right-hand side, and there's a whole section on transition. If you click on that, you will, again, have another whole page, and on the left side of that internet page are milestones, supporting skills, tips, and tools, timelines, healthcare information, higher education information, employment information, transportation, all kinds of information. That's accessible to anybody with a computer. That website again, www.uic.edu/DSCC. Okay. You may have also heard a term, a buzzword that's out there that's called medical home. That has to deal with your relationship your child's relationship with your primary care physician. The care coordination team will work with you and make sure that you have a relationship with your primary care physician that meets your needs and your child's needs. It is being promoted very heavily by the American Academy of Pediatrics and the Maternal Child Health Bureau. So this is something you should have a primary care physician, pediatrician, or a family practice physician that you have a good relationship with. And we want to make sure that that is working for you. The teams in the offices, I told you we have professionals and they work with professionals, the care coordinators and program coordinator aides. The care coordinators consist of staff who are either nurses, social workers, there are some audiologists, there are some speech-language pathologists. Those are the types of care coordinators that are available in each office. And then the program coordinator aides work with those people. You may have a nurse assigned to you, but know that that nurse is not the only one in this office that cares about your child and you. If your child has a hearing impairment and your assigned care coordinator is a nurse, he may not be completely aware of all the ins and outs of the needs of a child with a hearing loss. But the other team members in the office will be accessible to that person. All they have to do is stick their head in the office door and say, hey, can you look at this report and tell me if there's anything I need to be concerned about? Or the parent has called with this question. Can you help me find out what I should do? The other thing is that the managers in the offices, like myself, generally are here to help out. We keep an eye on things. There are over 500 children that are served out of this office. The staff here, have an assigned caseload. I also will look at all those records over the course of each year to make sure that you are getting what you need. Other managers do the same. If you ever have a problem with not getting the response that you feel is appropriate from a care coordinator, you need to know that you can call the office and ask for the manager. Talk to the manager about the situation. As a manager, I will tell you I can't fix something if I don't know that it's broken or in danger of breaking. So you need to communicate with the managers, not just get frustrated with your care coordinator, okay? Let us know if there's a problem. The one thing we do, I said if you meet financial eligibility, we can assist you with making some of your copays, your deductibles, things that are not covered by your insurance. We are a payer of last resort, so we want you to maximize your insurance first. We understand that insurance is confusing. Believe me, we've all been through it personally, and in the 21 years that I've been here, insurance has changed, and if you want to talk about barriers sometime, we can really get into it, but I'm not going to go down that road right now. We will help you figure out your insurance. If you hit a snag, if your insurance company won't tell you if something's covered, let us know. We have staff here who have been very specifically trained to talk to your insurance company. Okay. Some of the things that we assist with are things like specialty physicians. So not your primary care physician, but your ENT, your otolaryngologist, your audiology appointments, any therapy services that are ordered by those people that are not simply developmental in nature, hospitalizations that are related to your child's eligible condition, the audiology services that are necessary to maintain that hearing aid, and to make sure that your child's hearing is appropriately amplified. For children with orthopedic conditions, we pay for braces and splints. We do help pay for hearing aids. We also assist with wheelchairs, ramps, and lifts that are necessary to get a child in a wheelchair into or out of the home. We also pay for additional medical supplies that are ordered by the specialist for the specialty condition. Basically, ask us first. We'll let you know if something's covered or not. If you ask us first, then there aren't expectations that aren't met down the road. So, to refer a child to our program, if you don't know which regional office to call, you call this main number. It's 1-800-322-3722. Or you can go to that website I told you about, www.uic.edu/DSCC, and you can look up by county or zip code. When you call the regional office, you have to state, first off, right off the bat, tell them you need to make a referral. They're going to want to know the child's name, the parent's name, the address, the phone number, the birth date if you have it. Okay. If you are not the parent, we're going to ask you if the parent knows if you've called. It's always better, and you as parents, I'm sure, would feel this way or do feel this way. It's better if someone makes a referral for your child if they told you about it. We don't want to call you and say, hi, we're from the Division of Specialized Care for Children. We've been told your child is hard of hearing, or your child needs a hearing aid, or your child has cerebral palsy, and you didn't know we were going to call. The first thing that would occur to me would be, how the heck did you get my phone number? So, we really, really like for the parent to know that we're going to be calling. When we've gotten a referral, we will attempt to contact the parent. If we can't reach the parent, we'll try and leave a message. If we can't do that, we will send out an application with a cover letter that says, we tried to call you, we got a referral from, and we'll tell you where the referral came from. Our phone number will be on there. If you have questions about it, call us back. But we're not doing this just because we wanted to be nosy. We're doing it because somebody told us that your child needed our assistance. There's no obligation. You don't have to fill it out. You can call us up and say, hey, I don't want this. Take my name off your list, and we'll go away. One of the last things I'm going to talk about here, every year, DSCC co-sponsors this wonderful learning opportunity for parents of children who have moderate to profound hearing loss. What I'm talking about is the Institute for Parents of Preschool Children who are deaf or hard of hearing, which is a mouthful. We commonly refer to it as Institute. It's sponsored by our agency, Specialized Care for Children, the Department of Rehab Services, the Illinois School for the Deaf, the Illinois State Board of Education, and the Illinois Department of Public Health. Institute has been occurring every year for over 60 years. Parents who attend with their children often say that the week has been life-changing, the most important week of their life. Institute is generally held during the third week of June at the Illinois School for the Deaf, which is located in Jacksonville, Illinois. That means it's already happened this year. In late January or early February each year, Specialized Care for Children staff begin contacting families about the possibility of attending the June Institute. I can't give you any more information about Institute for next year right now. I don't have that information. Planning starts at the end of the year, and we contact families at the beginning of the year. Basically, that's it on my presentation. I'm sorry if I've made your eyes cross. I will be happy to answer any questions you have right now. Did I lose everybody?
Yeah, this is Mike. I have a question.
Sure.
I'm under the understanding that with the state, they've cut the drugs down for the different children, I think to 4.
Okay, yeah, that's through the All Kids Medicaid program?
I believe that's what it is, yes.
Yeah.
And do you guys help out with that if the child needs more than that?
Well, we can. Here's what I know about that. We have had to ask for clarification because we have a lot of children who have a medical card and need more medications than 4. They will give, you can get your 4 paid for through All Kids without a prior approval. If in a given month you need a 5th, 6th, 7th, however many medications for your child, the pharmacy simply has to contact All Kids to get a prior approval. The pharmacies that work with All Kids have that phone number, and they know that process. Having said that, obviously, this could create some difficulties because there's going to be a lot more of these requests, these prior approval requests. That was effective July 1. This is July 9. I don't know how that's going. But what we do require is that you attempt to go through the process, and then we will help out if you hit a snag. We'll either try and get that prior approval for you, or if it's something we can cover and it's related to the child's eligible condition, we will do so. Did that help?
Yes.
Okay. Anybody else? Okay, so I either told you everything you already knew or I confused the heck out of you.